Hello class, my name is Angela Palacio and this is Multidimensional Treatment Foster Care. This was a very exciting project for me because I found this as a social work student to be a wonderful alternative to typical foster care treatment, and it seems to be very effective, and I would like to see it used more in our own community. So, multidimensional treatment foster care is a non-restrictive, community-based intervention for youth aging 12 through 17 that have severe delinquency in their backgrounds and as well in their families. Also, many of these youths have emotional and behavioral issues and disturbances that they are currently dealing with. Instead of having to go to a very restricted and even uncomfortable setting such as jail or a hospital, they are allowed to be sent to a structured environment that can provide care for them. So they don't necessarily have to go to jail. They can still be somewhere controlled and somewhere where they will be supervised without it having to be an actual facility or anything like that. Many of these youths have been removed from their home due to delinquency, substance abuse, different involvement with the system. Many of them have gone to jail as well, and so they have been removed from the home. And multidimensional treatment foster care is definitely an alternative. And it's typically used once different out-of-home placements have failed, or they're not really meeting the needs or making improvements as they should be. So they do have different home and community settings. So a lot of these are in foster homes with foster parents, but there are also some alternatives. The purpose of multidimensional treatment foster care is really to adjust problem behaviors and teach the youth how to live, how to successfully be part of the community, how to break different cycles, and they utilize other resources to provide parents with support and skills training to also help their teens overcome these different situations. And ultimately, this will strengthen their bonds and lead to reunification with the family, which is always the goal, the ultimate goal of this intervention. So it is cost effective, and it is suitable for all ethnicities and for both males and females. Okay. The goals of this intervention, basically the program philosophy and goals are centered around encouraging the youth to break different cycles of behaviors and improve in many areas of interpersonal and academic skills. Ultimately, it is geared to reduce delinquency, of course, and encourage structure, limits, and positive pro-social behaviors and family strengthening within the community as well. Foster parents, the foster parents are very trained, so it's not just anybody that can do this, and the reason for that is because these are a different type of foster. It's a different type of foster community. Potential foster parents must undergo extensive pre-screening and be certified because this intervention is very different. They must be willing to work with adolescents who typically have more behavioral issues, more emotional issues than the typical adolescent in foster care. Also, they have to be willing to be significantly involved in their day-to-day activities. Because the program is so structured, they have different activities, different things that they do that these parents must be involved in constantly. They are also part of the therapeutic aspect of the intervention, and they must be willing to do this as well. Potential parents go through 20 hours of training, pre-screening, screening afterwards, and this training consists of role play, instruction, and case examples. Now, all of these trainings are also supervised by caseworkers, by supervisors, and they also have to keep attending parent training sessions, meetings, and basically this is a constant process, so it doesn't just end beforehand. It's a very intense, very involved process with these adolescents. Okay, a little bit of background about the program. So it was established in Eugene, Oregon in 1960s, 1970s, and this was established in the Oregon Social Learning Center. Later on in 1983, Patricia Chamberlain established a model, which is where all of the programs that use this intervention are based on. Currently, the research is funded by the National Institute of Mental Health, Drug Abuse, and Child and Health Development. Also, they do have funding from the Department of Health and Medicaid programs that are available in that area. Still to this day, this program is very implemented and it's most common in that state. But since then, between 3,000 and 4,000 youth have been able to participate in this program, and it has extended to areas of Canada and Europe, which I think is very wonderful because it's not just something that we use here in the United States. So the model can be used in different countries and different cultures and still have a good effect. Okay, so the multidimensional treatment foster care is based on Bandura's social learning theory, which is centered around observational learning. So their goal is to teach and help these youth adjust their negative behaviors by having different positive examples and mentors, and this way they're able to adjust their behaviors early on, still in their teens, so they still have a lot of time to fix certain problems. Theoretically, daily interactions, what they're saying is that daily interactions between family and youth shape both their anti and pro-social behaviors. So what we learn in the home is very important and will trespass to what we do outside of the home. So that's basically what they're saying. And they're also saying that negative behaviors directly lead to antisocial behaviors, and this puts these different youth at risk for juvenile delinquency, association with different delinquent peers, drug use, and of course later on in their adult life, incarceration. So we really want to break the cycle here. And the orientation of the program is mostly about social bonding, it's behavioral and social learning, which is very important. Okay. These teens have different risk factors and protective factors working for them. So a lot of the risk factors include aggressive behavior, poor communication skills, different physical aggression, poor family interaction. A lot of these don't have close bonds with their families, so it's very hard for them to come from a place to be able to deal with different situations in their life, which is why they have ended up, in substance abuse and different activities, which is why that they're here to begin with. The protective factors for them, once they are entered in the program, is a very structured environment. They have clear standards. The foster care works on a 3-point level system. And the 3-point level system basically rewards them for good behaviors, but it also implements consequences for negative behaviors. And through the program, which is 6 to 9 months, I'm not sure if I mentioned that before, but once they keep completing good behaviors and their chores and their duties, they're allowed more freedom from their supervisors or from their mentors. So they learn that with good behavior comes good rewards and more freedom, which they wouldn't otherwise have, for example, in juvie or the hospital or anything else like that. They also are taught different problem-solving skills, skills for social interaction, and parental social support. So they learn how to build different bonding and different relationships with their own parents, which is, like I mentioned before, part of the ultimate goal, reunification with their parents. So it really teaches them to be able to form or fix or adjust the relationships that they already have into a more positive form. The funding. So this program is cost effective. It is about $200 per day per child. They do have a lot of state and federal funding. They have local funds. They have Medicaid programs. They also have foundation grants, which they don't have to pay back. Sometimes they have public or private partnerships depending on different programs or agencies in the area. And they also have debt financing, which allows them to repay wherever they borrow the money from based on the outcomes or based on the money that they do make off of a certain program. And very importantly are the outcomes. Especially for girls, pregnancy is always a big issue, especially nowadays that women are getting pregnant earlier in their teens. So it's a big social issue, the whole teen pregnancy thing. So for girls, they have seen fewer days in locked settings, so has to be a little bit less supervision, which is good. Fewer criminal referrals, and reduced chances of becoming pregnant. And this is due to education and due to different things that they do in this program to prevent them and educate them from becoming pregnant in 12 or 13, which wouldn't be really beneficial for them in the situation they are already. And for the boys, they have incarceration rates 60% lower, and this is being compared to a comparison group. And there are fewer arrests, referrals, and running away from the program, which is more common in boys than girls. Here is the link to a video about multidimensional treatment foster care. And I'm sure we all do. I still have some work to do, some things to adjust, but I really have enjoyed learning about this program. I hope to see it here in the community in Florida. I know that we have different foster care programs and different options, but this seems to be a very good alternative, because we do have to realize that different clients are going to need different types of programs or of help, and we have to meet the needs for everybody. There is still current research. There's a lot of research I have to look at, and the methodology and different things like that. But I hope so far it's so good, and I appreciate it. Thank you.